Good evening, everyone. Warm welcome to all our participants who have joined us today for this insightful session on the basics of ESG, that is, environmental, social, and governance. So, as we are seeing the global landscape, it is shifting towards the sustainability and understanding how our organizations are impacting the world and vice versa. This has been, become more critical, especially within the healthcare sector. So today we have our moderator with us, Dr. Shweta Prabhakar, who is the regional lead for the North region of the Health and Environment Leadership Platform. It's an initiative by Public Health Foundation of India and Healthcare Without Harm, and it serves as a Indian chapter for the GGHH, that is Global Green and Healthy Hospitals. So without further ado, I would like to hand over the rest of the webinar to Dr. Shweta Prabhakar to set the context and begin the session. Over to you, ma'am.
Thank you, Nikita, and thank you, PHFI and Healthcare Without Harm, and our very own HELP platform. So it's my honor here to start the first of its series on basics of ESG, and this would be an initiative from the North region on the HELP platform to create awareness regarding the ESG basics and subsequent what are the components, because healthcare is one of the industry which contributes quite a larger chunk of waste, and we have our ESG experts with you. I'll briefly introduce with him. Before we go on to introduce him, I would just like to give you a context that this is an initiative in terms of in the roadmap towards creating awareness in the healthcare community, and we are very delighted to have all of you here to explore the fundamentals of ESG, which stands for environment, social, and governance practices, and this is an area that is increasingly shaping the future of responsible business and sustainable growth. On in this session, we would go on and explore the valuable insights which Dr. Karan is going to be sharing with us on how these ESG principles can be integrated into our own organizational strategies to foster accountability, resilience, and long-term impact which could create in this journey. And Dr. Karan, we warmly welcome you and thank you for giving us your valuable time and your commitment towards this journey, where we would be creating this awareness drive, and this would be a 6-month long journey, and every month we would be coming up with the subsequent topics on the how we can incorporate the various components of ESG. Dr. Karan is the Group Vice President at Corporate Affairs and Sustainability for Apollo Hospitals Group, and he manages the group external engagement, including government and industry liaison, along with healthcare sustainability and the ESG divisions. He is a seasoned healthcare administrator with wide experience in the field of health policy, health operations projects, health communications, and healthcare sustainability and ESG. He was awarded in 2022 as Global Fellow from India for Eisenhower Fellowship Award. In 2024, he was awarded the prestigious Shevings Gurukul Fellowship for Leadership in Excellence at the University of Oxford in the UK. We are very proud that you are one of the Indians who have taken this fellow award. And most recently, Dr. Thakur has authored the Handbook of Healthcare Sustainability and ESG, the first of its kind book for practitioners and administrators on sustainability and the climate and health. And this brings us, I hand over to the ESG expert. There is a lot to learn from him. He's a very humble, down to earth, and but full of insights into ESG. Hope we gather some insights today and in coming times ahead. After the session, we would be opening the Q&A, and we'll take on subsequently how we can dwell upon those challenges. Over to you, Dr. Karan, and thank you.
Thank you, Dr. Shweta. Thank you for that wonderfully generous introduction. And, I would like to thank the Help Network, the Secretariat, the leadership of Help also the broader GGHH network for making this happen. But more importantly, I must place on record that this the ideation behind this entire series was Dr. Shweta. So thank you for thinking of this. ESG and sustainability are very important issues, like you said. And while a lot of us have some level of understanding about them, it's always good to understand the science, the evolution, and what we can do in terms of implementing this in whatever way possible within our own hospitals is going to be important in the years ahead, like Nikita contextualized and like you very rightly pointed out in your opening remarks. What I intend to do over the next 45 minutes is to walk the attendees through basics of ESG. We will not get into too much jargon, but we will also try to understand the principles that are behind it. What are some of the reporting platforms that are available to us? How do we move from theory to practice? I will also share some examples from my own organizations at the Apollo Hospitals Group, what we have been able to do. We will divide this presentation into basically three parts. First will be to get a more granular level understanding of why we need ESG in organizations, why has it become important. Second, what are the principles and the fundamentals of sustainability and ESG within the healthcare sector. And finally, some use cases in terms of what hospitals can do. And while I give examples from Apollo, I do understand that, we are a large organization. We may have some of the resources that are available to us, which for many of those who are attending may not be so, or there might be some challenges on the resource front. But it's always important to lay in a good program and start small, and then build on that as more resources can get aligned to it. So that is what we intend to do over the next 40 minutes or so. Just to put some context into why we are having this entire discussion, is because of climate change. And we know that our environment has changed quite dramatically from the 1940s, and even prior to that, from the late 1800s, because of industrial activity and human activity. Because of that, weather patterns have changed, and the entire climate has also been altered. Now, there is always this question about how much is this because of human activity? Well, scientists have now conclusively proven that climate change and global warming are primarily being driven by human activity, and this is now a scientific fact. The aim for the world is that we should not rise our normal temperatures above 1.5 degrees of the mean average, meaning that if you take the average of how much temperature is on an average in a particular place, it should not rise 1.5 degrees above that average. And the measure is from the 1800s. So this was an ambitious target, but you see in this slide, unfortunately, carbon dioxide levels have continued to rise. There was a small blip because of the COVID era restrictions, but other than that, despite all efforts, there has been a rise. Now, of course, there is population growth, there is industrialization. So some of this is going to grow, but we need to really flatten this curve. And we know that the past 2 years, 2024, 2025, were recorded as the warmest years in human history. And this will unfortunately seem to continue. So, a global crisis that is amongst us is not just about climate. We also know that climate change impacts human health. And that's why we in the health sector need to always look at the climate crisis as a health crisis. Now, let's understand what is contributing towards this and why are we talking about this subject. First and foremost, we know that carbon dioxide is a cohort of gases called the greenhouse gases. Greenhouse gases have a warming effect. They trap heat in the atmosphere, and because of that, temperature rises as their concentration rises. So, carbon dioxide is pretty simple. We know about it, and we know that because of of various types of fossil fuels like petrol, coal, and all, we are generating carbon dioxide. But also for healthcare, we need to see that the other three, cohort of gases is also very important for us. Methane is the next big, greenhouse gas, and that when we are, doing various activities, even when we are providing food and that food waste is being generated, it leads to the creation of methane, which is very noxious for the environment in terms of its warming impact. Similarly, nitrous oxide. Nitrous oxide is apart from other industrial sectors, when in service sector, we are the largest user of nitrous oxide. So it might be a small percentage, 6.2%, but the contribution of the health sector is quite large in that contribution because we use this in anesthesia, we use this in ORs, we use this in other processes, labs, and so on and so forth. And lastly, the smallest amount of this cohort is fluorinated gases, HFCs and CFCs. And this is found in refrigeration. Now, again, as hospitals become more formalized, we know that air conditioning is a rising phenomena. Even in government hospitals now, increasingly, air conditioning, even if not centralized, but decentralized air conditioning is now a reality. Think about our labs where we use refrigeration. Think about blood bank where we use cooling for blood products. A wide variety of areas use or at least consume fluorinated gases, which then cause a heating effect. And all of these then get released into the environment, and they are then given a division in terms of a scope. Scope one are those emissions that we put out directly through our hospital operations. So every time I switch on a light bulb, that is my scope one emission that I have done. Every time I switch on my generator, that is a scope one emission. Scope 2 emissions are those that are emitted in my purchase of electricity. So just the transmission of that electricity to my hospital, or any resource being used like water or waste, is a scope 2 emission, or an indirect emission. And then through the supply chain, all the materials that we provide contributes towards scope 3. So those are the three big scopes, and those are the gases that cause climate change. Now, what is the impact of climate change on hospital operations? Why is this important? We know that climate change and climate disruption is causing a massive impact on supply chains because of unpredictable weather, flooding, air pollution, or even heat waves. There is a break in continuity of our supplies, and because of that, there is a major challenge which presents itself in terms of the supply chain that is critical to hospitals. We saw that during COVID, when supply chains were being a problem, how that impacted our operations. Second, there is a resource availability depletion. Water is becoming more scarce. Electricity is becoming, in many places, uneven supply, or there is supply which is disrupted because of climate change or extreme climate events. There's an increase in operational costs. We know that if there is flooding that happens, or even when there is an extreme heat wave, we need to then get our operations to be resilient towards those changes that we are seeing. And because of that, operational costs go up. So you need more infrastructure to make sure you can actually respond to that crisis. And then adaptation, to adapt to this new reality, is also an impact that we see. Lastly, we also see a financial risk. If our hospital shuts down because of any extreme climate event, or if there are parts of the hospital that are not functioning because they may not be resilient enough, there is a financial risk. If your hospital has ever got flooding or had to shut down because of a climate event, even your insurance cost of the building and the equipment goes up in terms of the premiums that you pay. So there is a financial cost also that climate change is putting on hospitals. But at the same time, there are also opportunities. There are enough green opportunities, green technologies, and innovations that are making themselves, into the hospital. And we also know that the health sector, has been very aware of the importance of the environment. We know that the environmental movement is not new; it is 50 years in the making. And conservation is something that both within India and within the health sector, it's something that we promote. Most of our hospitals are doing some bits of work on greening our facilities, making sure there are more native plants that are growing, and so on and so forth. So again, this is not something new, but there is something that we need to look at. Now, because of all these wide-ranging impacts that we've had, the increase in carbon dioxide levels and greenhouse gas emissions, it's not as if the world has stood still. So this is a global issue now, as we know. And sustainability itself, the definition is an old definition, is nearly 40 years old, where we define sustainability as meeting the needs of the present generation without compromising the ability of future generations to meet their needs. The evolution of that was that there were sustainable development goals, 17 goals that were put out for the world to follow, and within that, climate action was one, and so was healthcare and other things. So the response to the climate crisis, the response to the need for more sustainability led to sustainable development goals. In 2015, many of you would have heard that we got the Paris Agreement signed and endorsed by most countries, and this gave the definition of a net zero, which every economy and country must work towards. And also, we came out with what is called the NDCs, which are the nationally determined contributions, which are basically goals and targets that each country must meet to make sure that we get to net zero and achieve the principles and directions of the Paris Agreement. And COP26, which is a conference of all countries coming together on climate in 2018, our Prime Minister gave Panchamrit as India's contribution, where we were looking at doubling the amount of renewable energy that is being produced, looking at all sectors contributing towards reducing their own carbon footprint. So again, our goals are tied into what are nationally determined contributions, in this case, the Panchamrit. And very recently, we've had Climate and Health Day, where climate and health are being discussed together. And when India hosted the G20, the New Delhi Declaration very categorically mentions that there should be a commitment by all countries to work towards an adaptive, resilient, low carbon, and sustainable health system. So, again, this has become a global goal. So, why does this matter? All of this matters because without an organization and without a sector contributing towards these larger goals that I showed in my previous slide, we will not make much progress. And how do we do that? So, while sustainable development goals that you see on the left hand side of this slide, those are those tiles that you see of different colors, there needs to be some sort of mechanism that is available to organizations to contribute towards these goals. And that's where ESG really comes in. And ESG looks at three base, verticals of great importance: the environment, which we spoke about; social, because as I said, this impacts employees, it impacts their families, visitors, patients, communities, society. So social dimension is also very important when we look at our sustainable development. And lastly, governance. We know that without good governance, organizations cannot deliver on their mandate. And in healthcare, it's even more important because we are dealing with human lives, and we have to make sure that we run ethical and robust organizations that can deliver for the needs, the healthcare needs of society. So if you see on the right hand side of this slide, I've tried to encapsulate how all of this comes together. At the core of what we are trying to do is a global goal of meeting the United Nations SDGs, the tiles that you see here of different colors. How are we going to achieve that is another global goal that we have, is through the Paris Agreement, or working towards net zero. So that's the other part of how this is working together. And on the outer side of that is how then countries are contributing towards it. And countries are really contributing towards this by our nationally determined contributions. And then how do organizations achieve that is through ESG. So if you see, there is a quite clear distinction in terms of who is supposed to do what. You and I together are contributing towards SDGs, but we will do that through sustainable practices under an ESG framework. So that is the correlation between sustainability, sustainable development, and also ESG. Now, if we break down what ESG looks like, we saw that correlation with sustainable development goals, but very specifically, ESG covers the following. In the E, it looks at the environment, but also its own footprint, the energy efficiency that we have, the carbon footprint, greenhouse gas emissions, and so on and so forth. And for us, waste management is a very major component of the E component. But a lot of conversation goes on E. We should not forget the S and the G. On S, we look at our labor standards, what wages are being given, how much diversity do we have, both at the board level but also at the workplace, pay equity, attainment of human rights for everybody, talent management, community relations, and also data privacy. Since we are such large guardians of such large data, patient data, and very sensitive data, we need to be very careful that we follow all ethical standards, regulatory standards, and compliance to make sure uh, that data is not breached and that data is not used in an unethical way. And G, as I spoke about, looks at how governance is managed within an organization in terms of compliance, in terms of making sure there's no unethical behavior, there is no bribery or corruption. And all of this links to what is now called the four P's approach, which looks at people, which is the S, looks at planet, which is how well we ensure financial sustainability, but with a purpose. And that's where elements of the G also come in. And we've seen now ESG getting into strategies of organizations themselves. A good ESG program will make sure that you manage your risks better because you'll identify risks more cleanly, more clearly. And I'll show you some examples of how you can do that. Second, because we are looking at the entire spectrum of stakeholders, our relationship with stakeholders also improves because there is better transparency, better disclosures. The communities that operate around you or stakeholders that you deal with know that you're operating in a certain way and manner. And of course, today we are seeing because of good compliance on ESG, there is a lot of movement of both talent towards such organizations because you're seen as an ethical and socially conscious organization, but also there is availability of funding where investors, banks, and so on are wanting to put money into ethically run organizations. And while we do ESG and sustainable practices, it is not just for some good or larger contribution towards the planet or the nation, which we must do. It also has great implication in terms of the benefits that organizations get. It is documented that there are cost savings when you do energy efficiency, when you move towards better practices, which can help reduce the amount of resources that you are consuming, therefore also positively impacting the climate. Improves brand loyalty. Today, we ourselves are looking at products and services from organizations that make a meaningful, statement and does actions on, improving the state of the planet as they deliver the service and goods that we desire from them. As I said, access to investment, both on the investor side, but also for funding of new projects, is taking a green lens. And there are a few Canadian studies that have come out, including also some American studies, which say that long-term performance, financial performance of organizations improves if they are ESG compliant or look at ESG more seriously. And of course, there are health co-benefits as the environment improves, as the water becomes cleaner, as the food cycle becomes more nutritious. There is obviously going to be an positive impact on people's health, which is ultimately what we are trying to do. And lastly, and I have seen this personally, a lot of talent now is either being retained or attracted to organizations that are exhibiting meaningful action on sustainability, on ESG. So again, this becomes important. So when you look at organizations today, if they are not ESG compliant, if they're not talking about ESG, not only do they lose on attracting talent, on attracting financial investments, or doing savings, or just being compliant. They're also going to lose talent if they're not attracting, if they're not being sustainable or have enough practices. So again, that becomes an important chapter, to discuss in terms of. That is one dimension that we must keep in mind, that we must do this to attract the best talent. And often this is not spoken about as much as other aspects, the positive aspects. Now let's shift our focus. We come to the second part of this conversation. We really looked at what are some of the reasons why we must do this, and what are the positive impacts that ESG and sustainability does, and also why this is tying into a larger national and international global commitment that countries have made for themselves. But when we look at the health sector very specifically, so yes, climate change is impacting human health, but the health sector itself has a big contribution towards the impact that we are having on the climate. And this is like a bi-directional relationship, where we see that healthcare sector contributes to about 5% of global emissions. And these emissions come from varied sources, and most countries tend to display a similar type of pattern, where a significant component does come from the scope 1 emissions and scope 2 emissions that we spoke about previously, but a large chunk of it also comes from the supply chain. And therefore, we need to work with our supply chain partners and stakeholders to make sure that as we work on our ESG, it's not just for the organization, but also goes into the stakeholders that work with us. Along with that, we are very unique because we also negatively unique in that sense. We also release toxins, wastewater, and biomedical waste generated through our operations, and this will continue to happen. When we treat patients, there is no way that we can bring that number down to zero. And how do we make sure that we work towards be rationalizing the generation of that waste or consumption of resources? And just to put this to context, a single CABG surgery, CABG that happens across the length and breadth of our health system today, just a single one, releases emissions equivalent to a small petrol car traveling 250 kilometers. Now, if you extrapolate from that, the number of surgeries that are done, complex procedures that are done on a single daily basis, you can imagine how much emissions the health sector is, releasing into the atmosphere. And when we see what is the contribution of each health sector, or each health system of each country towards a larger pie of emissions, the picture is quite similar to overall carbon emissions. So on the left hand side of this slide, if you see, we see that maximum carbon emissions are happening from the United States and China, and we see on the right hand side of this slide again the maximum number of healthcare emissions are from the United States and from China. And India's contribution looks a bit odd here. When we see the total emissions versus how much emissions the health sector is doing, there is a mismatch here. So while India is contributing to about 8% of global emissions, when we look at that picture for the health sector, it's only about 2%. Now, of course, this number is slightly dated. We do have a new number expected this year. So this number might be now 4%, but again, there is a difference between the 7.38% on total emissions versus the health sector emissions. Now, this is when we don't have enough healthcare facilities for all our people. So as India grows its health sector, the fear is that our healthcare emissions will also continue to grow. So we don't have the luxury to just continue to grow the way we want to grow. And let's look at the second part of that bidirectionality. We know that climate change is also impacting human health. If you see the inner wheel of this, a wide range of changes are already taking place because of rising temperature, extreme weather events, rising sea levels, increasing carbon dioxide levels. All are causing myriad effects on the planet. This could be air pollution, severe weather, extreme heat. This is happening on a regular basis now. This is changing vector ecology, it's increasing allergens, and also impacting not just the environment, but our water and food systems also. And because of that, we see the outer rim here. No part of the human health system is immune to the impacts that climate change is having. So, again, this becomes very important for us to start considering the contribution that climate change will have to our patient base, not just for today, but also for years to come. So this becomes important to really understand and to build to the fore. So what should we do, and what has been done? One way of looking at what we can do is to look at reporting on the impact that we are having as organizations. So as you start putting together a program, and I'll give you an example of how you could do that, a program on sustainability and ESG, as you start taking those steps to reduce your carbon footprint, you will need to start reporting on this. And primarily, sustainability reporting was seen as something that heavy polluters do. So the oil and gas, the FMCG, and others. But today, the expectation is that all organizations, irrespective of the sector that you're in, will start reporting on some bits of their sustainability, either in an annual report or as a separate report, or you at least put out some material on the internet or on the website so that people can publicly publicly available information so that people can see the impact that you're having on the climate. So this becomes important. And there we see that when you report, 10 issues are very important. And again, you would notice that ESG does not move very far away from what is our core. The first four of these are something that we've reported on any good quality program that we may be running in our organizations: service quality, patient safety, quality outcomes, accessibility, health equity. These are things that we do on a day to day basis. And obviously, measuring the voice of customer, looking at the satisfaction levels and so on. So even in ESG, they remain important. But others, maybe some are new for us, but others may be reported by other parts of the organization, but are important. Cybersecurity and privacy. So how well are we taking care of that important aspect is important because we deal with hundreds and thousands, and in many cases, lakhs of medical records or small pieces of data that needs to be protected. Labor management, we have such a diverse workforce. We have doctors, nurses, we have medical staff, we have non-medical staff, we have janitorial staff, and then we have suppliers. So our labor management also needs to be in compliance, which means fair wages are paid. People have a recourse to any issues that they may be facing, so they have that grievance redressal mechanism that is available to them. There is an engagement with the organization of employees and by employees so that they can voice and air any concerns that they have. And we must give them a clean, safe environment to operate in. Again, this is something that we see in the quality dimension when we look at how we take care of our staff. This becomes important again in ESG. And then other issues of the G, like I spoke about, community development, business ethics, and compliance are important. And last but not the least, the major E, which is to look at our environment, our carbon emissions, waste, and water. So just like we have reporting standards under JCI, under NABH, and other certification bodies, ESG is no different. ESG also has reporting frameworks, and I would strongly encourage you, if you're interested in this field, to start looking those up so that you can understand how reporting is to be done for a program that you may put together for ESG. The three major ones that I like to point out towards are the GRI, and this is really the gold standard for reporting. It's not healthcare specific, but it covers reporting for and disclosures for sustainability for any organization. And this is again, the standards are available for free. You can go to the GRI website, download the various standards and start reading what is the expectation in terms of GRI reporting. If you want how this report looks on the ground, you can head out to my organization's website and download our sustainability report. At the end, we have a GRI scorecard which shows how we are disclosing data against GRI standards. The second is what is called SASB, which is now part of IFRS. Again, you don't need to remember all of this, but SASB is another good set of standards that are there, some relating to healthcare or community development, but again, good set of standards you could look at. And third is really broader goals on environment. While we have healthcare specific standards, it's important that we start building our ESG program around GRI, SASB, ISSB, standards, because otherwise if you don't have something that is reliable for somebody, for an external stakeholder to see how you performed. So as I said, ESG is various types of standards. So there could be some GRI standards, My information GRI is now working on some healthcare specific standards for disclosures. So again, as that happens, that will be a good example of is the difference obviously is that it looks at very different metrics. And here we are looking at leadership, we're looking at waste, energy, water, and the built environment. And very importantly, looking at chemicals, looking at pharmaceuticals, looking at food, and then looking at scope three, which is our purchasing and our transportation. And while we do that, we need to look at governance, purpose, and ethics, our stakeholders, the planet, that everything, all of those must be a cross-cutting theme. Looking at monitoring, reporting, and compliance, and then how do we make resources available to people. So again, quite similar to what you would see in any good quality program. So when we put all of that together, this is what it looks like. And you would see that there is a clear division of ESG in our mandate. This is an actual program that we have now running. So there's a purpose why we're doing it. There are some pillars. So if you see, healing our patients is our both a social and a governance aspect of it, because that's the core of what we do. Like I showed earlier, that ESG does not mean that we move away from what is our core. That is what is important for us. Empowering our people and partners. This really looks at the S aspect of it, and then looking at the environmental action, which is the E. So we've covered E, S, and G. And if you see, where are we reporting and how are we reporting? Well, we are reporting in compliance to the SDGs, the BRSR, SASB, and GRI. So when you put together a program, these are the components that are important. And mind you, this has to be very actionable, which means that you have to have metrics which will define what is it that we will measure under any of these pillars. So it's very good to talk about healing our patients or empowering people. What does it mean? So, for example, in climate action, it means reducing our carbon intensity, increasing the share of renewable energy. So it has to be a very driven metric, which is guided by GRI and other principles. So again, we will make the slide available to you. You can go through this in greater detail to understand how you can put together a program on ESG for your own organization. Just a few thoughts on what is important when you do that. One is we will need a good governance structure. In Apollo, it's driven by the board committee on sustainability, to which I report to, and runs across the organization. So this again has to be top down but bottom up as well, because we know the implementation will happen either at the patient bedside or at the hospital level, and there we need teams that are driven to deliver on this. Second important aspect is to look at what will your priority areas be. So these priority areas are defined by two sort of axes. One is what is important to me as an organization and what is important to my stakeholders. And there, when we look at those 10 important areas, you can then plot them in terms of what is important to you, what is important to your stakeholder community, and then look at these as priorities. Now, the number 14 here does not mean it's not a priority. It is a priority, but when we look at what is more immediate, we will then plot it accordingly. So I will tend to work towards those that are in the top right hand corner and lay emphasis on those more, but there needs to be a program for all of those running right down to the number 14 in this case. So again, this is called a materiality matrix, and this is something that you could do. So again, I'll just quickly walk you through this. When you put together a plan, it'll need to be organization wide, which will need to look at your footprint, which will need to then create an inventory through some of the tools that I spoke about, then put in a target, and then monitor it. So when we do monitoring, we are actually looking at data to drive our growth of the program. Here you see an example of that in action. We built this program for our large hospitals. So about now 20 hospitals are covered. This has been in vogue for about 5 years. And we've been able to showcase through small and big projects, about 200 small and big projects, some major savings that we've been able to do, both on diesel, on carbon equivalents that has been avoided. In fact, we have offset about 3 lakh households just by this program. So again, we are a large organization. All our hospitals are working towards it, but it can have a large impact. If you're a single entity or a small hospital, even there the impact will be just as much. It's about the proportion of it, not the actual number. So again, as I said, data will become important. This is some of the dashboards that we are now collecting. Again, some free tools available on the web. You can use them. GGHH, we would strongly encourage you to sign up your organization to the GGHH, which is a free sign up. And there are inventories and tools that are available for you to download to use to carry out this sort of an exercise for your organization free of cost. This is an Excel based tool and toolkit, and you can download this by just signing up to GGHH. And more information we'll be happy to provide through Nikita and the secretariat. So you can also create an inventory like this for your own organization. So I won't spend too much time on this, but it's not just about the environment, but it is also looking at other things, looking at training, looking at well-being for the employees, aligning ourselves with the SDGs, and ensuring gender equality as part of our social commitment. So that becomes important. And when you put targets for yourself, impacts do happen both on the waste and water and other reductions. So again, as I'm saying, when you put together a robust program, the initial years may not show large numbers, but there's a tipping point after which you will see major impacts. And I would strongly encourage you to start small, cover as many areas as possible, get people involved, but make sure that there is a robust program that everybody talks about. So just to summarize, it needs an all of the organization approach. Like I said, it needs resources and data management. It needs commitment from all of us. And there is enough material out there, and we remain available for any other hand holding that you or your organization may need. It does need a knowledge sharing, which is what we are trying to do here. But at the same time, when you put together a program, please be aware that there sometimes there is a tendency to talk more and do less. We must walk the talk. Let's do as much as we can, and then talk about what impacts we've been able to create. But I would strongly urge you to work in this field in whatever way possible, whether you're a doctor, nurse, healthcare administrator, quality professional, ops professional. There is a contribution that we all can make, and let's start with that purpose, because you saw the issue that we have at hand, and this will not happen by walking away from it or thinking it's somebody else's job, because the greatest threat to our planet is that the belief that somebody else will save it. We all have to contribute towards it. And with that, I'd like to once again thank you for your time and attention to be here on a Saturday evening. And thank you, Dr. Shweta, once again for organizing this. Back to you.
Thank you. Wonderful, Dr. Karan. It's amazing. As I mentioned that you have that vast experience and the knowledge, the abundance of knowledge which you share on ESG is tremendous. This one session is a less of a time, right? So, and the amount of work which we all have to do, this overview gives us that opportunity to realize and create that buzz about ESG. And being in healthcare, every day when you walk to the corridors of the hospitals, you look into that what one thing which I can do to bring a change. And we all have to bring in, like, I really liked that approach that all of the organization approach is important, that each one of us are part of this initiative of bringing in the ESG culture. So it started with the hospitals talking about quality culture, patient safety culture, and now there is an ESG culture which is to be should be brought in through this initiative. And I'm really quite excited in in this initiative to bring that change, if I can be one of those person to bring change in the healthcare. And I'm sure the attendees who are participating in today's webinar, and we would be also broadcasting this webinar for others to be aware about the Apollo taking the initiative of creating such a wonderful sustainability program. uh, there are few questions, and we have some of the attendees. I would open the participants if they can unmute. And Nikita, are they allowed to unmute themselves and ask questions, or
Yes,
hand
yes,
raise, or they have to type it in the chat?
anything will be fine. I'll allow them to talk.
Okay, done. So please go
Sure.
ahead.
I'll, in the meantime, just attempt some of these questions that have come up.
Yes, they
Thank
are
you
there.
for those. Yes, we will have recordings and also make this available. Strongly urge you, as Nikita has just put the membership form. Please take membership. It's a free membership of help,
Yeah.
and this will help you, with all the resources you need. Preeti, your question on how staff can be encouraged to use public transport. There are two or three approaches. One is to work with the transport department of your state or city that you work with to make sure that the bus stops are closest to the hospital. That's the most important aspect that we see, where staff then strongly get encouraged to use that, because then the last mile connectivity is not an issue. Second, organizations can provide that last minute connectivity to, if there is a big transport hub close to the hospital, from there to provide that last minute transportation is something that can be strongly encouraged. There have been organizations which gives vouchers, which subsidizes public transport. So that is again something that some organizations have tried. Yes, there might be small impacts on the financial aspect of it, but again, there is an uptick in terms of reducing the carbon footprint. Lastly, public transport to be provided. Many organizations do that. They have a bus that runs, so even if it is not public transport, it is a pooled transport, and that helps encourage carpooling. So those are some of the ways with which one can encourage. But again, it needs a stakeholder approach.
Yeah, thank you, Dr. Karan, for taking up. And these this health membership is totally free. We are in this initiative creating awareness, and we partner with us, being on the health platform. So, meanwhile, the participants are still thinking to ask the question. I have, few of some of my, areas of interest is that you spoke about nitrous oxide, and every hospital, most of the hospitals, functions, they are using nitrous oxide. And how do you see that? What is the approach which the hospitals can take, and what's an alternative if this nitrous oxide can be avoided? And can you guide us more on that?
Yeah, nitrous oxide currently does not have a replacement. So unlike other anesthetic gases like desflurane and all, so what we can do is to work with our anesthetists to see if we can deploy low flow use of nitrous oxide and others. Second, work with our engineering teams to see how much of this is being leaked. If there
Yeah.
are leakages, that is an important step that we can do, at least periodic checks to make sure that there is no escape of nitrous oxide that is being used. Third is to actually monitor the amount of nitrous oxide being used per procedure, per OT, or however we may want to do it, so that we can see any variances, and then work towards some bits of target to reduce the impact. And lastly, I think we must all encourage the sector to the supply side to make sure that they have monitors which show how much nitrous oxide is being saved or utilized through monitoring when they use the low flow systems. That is a capability which is available in many machines but is never taught. So I think those are a few ways that we can do. But um, I think, Dr. Shweta, we should think of how we can involve the anesthetist community in this.
Yeah.
We can work with them, and they have some very imaginative ideas, I'm sure.
Yes, thank you. That's a great insight into it. And some of the organization and the anesthetist community are aware of it, and they are working towards. And even there are teams who have published the data
Yes.
on
Yes.
the saving on
Yes.
the nitrous oxide. Uh, so another very interesting stats which you shared in your presentation about that in the Indian healthcare scenario, if we talk about the contribution, it is 81% is supply chain. Right,
Yes.
it is something. Oh my God, it's unimaginable. How this is the area where we need to focus on, and so some of the one or two pointers. I will not take much of a time, and in case
No.
if any of the attendees are eager to ask, please unmute yourself. I'm just from your behalf, I'm asking so that we learn more, and I would take this opportunity to grab some more information from you.
No, I think on the supplier side, the supply chain needs to be engaged. And one way of doing this is to first do an 80-20. There is no point trying to reach out to all the suppliers. The smaller suppliers will not be able to be a partner in your program because they don't have those resources. But we've seen 20% of the suppliers are usually large companies or large distributors. When you work with them, it's important to tell them that, look, I have to make disclosures in terms of how you are transporting, whether you have any electric vehicles that you're using, reducing your carbon footprint through your own efficiencies. You need to start reporting. One way you can do is, as you build a emissions inventory for your own organization, pass it along to at least 4 or 5 of your top suppliers and say, could you also do this for yourself? So that is one way of bringing them into the fold. Second is, if we don't look at emissions but beyond emissions, uh, the utility providers that you are working with can also help those suppliers to move towards renewables and others. So that is one way of looking at it. Third is, if you tie in contracts to say that I will work with you for the next 5 years. I am giving you that commitment, provided you move towards renewables by 10% or 15% or 20%, is one way of looking at it. But one suggestion would be, since we have so many different types of suppliers, look at the Pareto principle, look at the 20% that are giving your 80% of the supplies to begin with, and that might be a starting point.
Oh, wonderful. Thank you very much. And now the industries like airline industries, they are publishing that they are flying
Yes.
low carbon emission, setup, or they are generating low carbon emissions. And please, even in the flight, the itinerary which is being displayed. So, do you want to choose this flight or this flight? So that's
Yes.
wonderful. I think so. It's a teamwork, and we all contribute towards. It's like a chain. Where we do go about it. I think so. I have one question. I'll just let me. Okay, there is Dr. Naren is here, and he's saying replacement of nitrous oxide is cefluorine and desfluorine and isofluorine used with oxygen and air, and though
Yeah.
it is expensive.
That's the whole idea. Yeah, but
Yeah.
that's why nitrous oxide is so widely used. So I think and I think what we can do is to look at the engineering solutions to that. But thank you, sir. Thank you for that input, and welcome. Nice to have you.
Yeah. So, do we have any of the attendees? So today, in fact, I had a great time, and this I don't mind if it's a Saturday or Sunday.
You're too kind.
So thank you very much,
Thank
Dr.
you.
Karan. Thank you, Nikita from PHFI, and thank you all the attendees. And there are, Dr. Karan, just to mention to you that there are attendees from the hospitals, so they are, actually publishing this webinar, and so they have large hospitals staff also attending this. Wonderful session once again, and we look forward for the another opportunity and another topic which would be coming subsequently after we have covered the basic of ESG. And thank you once again. Have a great day. Have a great weekend.
Thank you.
Okay. Bye bye.
Thank you. You too. Thank you.
Thank
Good
you,
evening.
Dr.
Thank you,
Karan.
everyone.
Thank you.
Thank you,
Thank
Dr.
you.
Shweta. Thank
Thanks.
you, all the
Yeah.
attendees to attend this.
Yeah.
Thank you,
Thanks.
everyone.
Okay. Thank you, Nikita.